Welcome. My name is Kim Rosello, and I'm a peer community volunteer who is assisting Access and the Department of Health, Division of Behavioral Health Services, to inform you about the new RBHA contract.
In the new year, no matter what company is entrusted to provide care, services for Maricopa County members are moving to an integrated health model, a system designed to care for mind and body to foster whole health. This means better communication between your medical care providers and your behavioral health providers. In many cases, it means medical services and behavioral health services will be offered at the same clinic. The changes are designed not only to improve the quality of your health care, but also improve your life satisfaction.
To illustrate the power of a whole health recovery of mind, body, and spirit, I have asked Ryan Reagan to join us and share his personal struggle and journey of whole health recovery. Welcome, Ryan.
Thank you.
Tell us a little bit about your journey.
Well, it all started in 2007. That's when everything changed. It started with severe chronic pelvic pain. And because of this pain, I was in and out of the ER for 5 years. Because it was so intense, I became extremely isolated. I had to quit school, I had to quit work. I lost most of my friends because I couldn't do the stuff that they were doing at the time. And because of all that was just coming down on top of me, I was extremely depressed. I was going through a lot of anxiety because of that. For the first 3 years that I was sick, I had no diagnosis. I didn't know what was going on. They couldn't tell me anything. So the isolation, it felt like the pain and the anxiety and depression were just getting worse. So my PCP ended up referring me over to a pain specialist. And the pain specialist gave us an idea of what it might be based on the location where the pain was at. So I got referred over to a urologist. The urologist did a cystoscopy and found that I had interstitial cystitis, which is a severe bladder disease. And so they would put me on the pain medications, which didn't work. They wanted me to change my diet to chicken and rice. Didn't work. And then they wanted to do something called instills, where they directly inject the medication into the bladder to control the pain and the symptoms. But with the other things they tried, that didn't work either. Over the course of 5 years, I lost 60 pounds and just remained isolated, no friends, and just constantly felt hopeless and depressed.
What was the turning point? How did you get from being addicted to pain medicines, being in pain all the time, depressed, to where you're at today?
It started with the counselor. We wanted to try to see if a medication could help with the pain, depression, and anxiety all in one. So we went with a medication called Cymbalta, which is fairly popular now. After a few months of being on the medication, I noticed that my pain levels had dramatically lessened. So my counselor then mentioned that there is a wellness gym through the Mark Center that participants could go to help their physical body if they wanted to get stronger, be healthier. So I thought about it for a few weeks and then went down to the gym, liked what I saw, liked the staff, signed up, did the intake, and just started going 5 days a week, 4 hours a day. That's really when my body and mind started doing a 180-degree turn.
Yeah, that's fantastic. So working together, the mind and the body at the same time, along with the medication change, helped you to really move into a whole health recovery.
Absolutely. Without Mark Center, without the services that I had, there's no way that I would be where I am today. I wasn't going to go join an LA Fitness. I wasn't going to go just to some odd place to talk to anybody. I mean, the gym and their staff were one of the biggest things that helped me through the illness at the time and my recovery. The staff, they were patient, they were trying to understand, they were always there. If I ever had questions or anything, they would always want to help. So I really believe that without the Mark Center, I would still be in isolation. I'd still be suffering to this very day.
Thank you so much, Ryan, for sharing your journey with us. Like Ryan, many of us have physical health challenges that affect our mental health. Others of us have mental health disorders that prevent us from even looking at our physical health. Ryan and I would like to encourage all of you to participate and take advantage of all the new enhancements of integrated health in your clinics. Remember, you have the power to change your life.